Oh, didn't see you there. Diabetes is one of the most common health issues in Americas today. Millions of Americans are diabetic and millions more pre-diabetic. Prediabetes is a condition where your blood sugar is high, but not high enough to be considered diabetes.
There are two types of diabetes, type 1 and type 2. Type 1 is when your body can't produce insulin, and type 2 is when your body can't respond to insulin. Insulin is a hormone that allows glucose to enter the cells and produce energy. There are many symptoms with type 1 diabetes.
Increased thirst, frequent urination,
Weight loss.
fatigue.
Type 1 diabetes is usually caused by genetics. Some people have a certain genes that makes them more likely to develop type 1 diabetes.
All diabetics should be aware of what they put in their body and what they consume.
Diabetics have to be so focused about this topic because they do not want their blood sugar levels to get too high or low or have too much insulin roaming throughout their bloodstream.
All diabetics should consume foods that have an abundance of healthy vegetables, whole grains, fruits, and limited carb intake. These carbs eventually turn to sugar in the body. And lastly, choose lean meats and non-fat dairy products.
Other foods diabetics should consume consist of blueberries, beans, nut butter, avocados, flaxseed, and green apples.
Exercise is an absolutely vital part of your type 1 diabetes treatment.
Staying fit and active throughout your life has many benefits, but the biggest one for people with diabetes is this. It helps you control diabetes and prevent long-term complications.
Exercise makes it easier to control your blood sugar level. It benefits people with type 1 diabetes because it increases your insulin sensitivity. In other words, after you exercise, your body doesn't need as much insulin to process carbohydrates.
You should aim to get at least 30 minutes of aerobic exercise most days of the week. In fact, the American Diabetes Association recommends 150 minutes of moderate intensity aerobic exercise a week, which works out for 30 minutes 5 days a week.
For type 1 diabetes, your doctor may recommend blood sugar testing 4 to 10 times a day. You may need a test before meals, snacks, before exercise, before bed, and sometimes even during the night. You may also need to check your blood sugar levels more often if you are ill or you have a change in your routine medication or stress levels.
You need to test your blood sugar to see if how diet and exercise affect blood sugar levels, how other factors such as illness or stress affect blood sugar levels, to monitor the effect of diabetic medications on blood sugar levels, and identify blood sugar levels that are high or low. Hemoglobin A1C, often abbreviated HbA1c, is a form of hemoglobin that is bound to glucose. The blood test for HbA1c level is performed in people with type 1 and type 2 diabetes. Blood HbA1c levels are reflective of how well diabetes is controlled.
You may be wondering how or what I use to test my blood sugar levels. Well, blood sugar testing requires the use of a small electronic device called a glucometer. The meter reads the amount of sugar in a small sample of blood, usually from your fingertip, that you place at a disposable strip. Your doctor or diabetes educator can recommend an appropriate device for you.
Second step is to put the strip in your meter. Then, you prick your finger with your needle. Gently squeeze the blood onto the strip that's inside your meter. It will display your blood glucose level.
Most people will have to test every 3 to 6 months, but you may need it more often when you're planning for a baby, your treatment has recently changed, or you're having problems managing your blood sugar levels. You can either have this tested by yourself performing it, or you can have a trusted healthcare professional.